Medicare is very confusing. And I may or may not make it seem like it's more confusing, but I really am trying to demystify it to some level or another. Managed care plan, original Medicare, you shouldn't change it without understanding the consequences. I am trying to educate on things that I see within the healthcare system, home health, and please like and repost and follow for more healthcare tips and home health tips. Okay. Medicare has all sorts of letters. Medicare Part A. Medicare Part A is coverage for your inpatient hospitalizations. Now, keyword inpatient. When you are in the emergency department, you are still outpatient. That is covered under Part B. When you are in an observation status within the hospital, that is under Part B. I apologize for the lighting if it makes it a little weird. Now, sometimes when you are in the hospital and you're moved from the emergency department to a different room and floor, you may think that you are being admitted to the hospital. That's not always the case. There are reasons why they don't admit you. That's a whole nother video. But the point is that until you are in inpatient status in the hospital, you are under Part B. Part A also covers rehab, skilled nursing facility, home health, and hospice. Hospice I will do a separate video on because that's a whole nother confusing thing. Part B, your doctors. So like I said, if you're in the emergency department, observation, your doctors are covered under Part B. Even when you are in patient status in the hospital, the coverage for the doctors still wraps under Part B. Confusing, right? And which that means that all of your, 20% or whatever amount that you are cost sharing in this situation will still be there for the doctors, whatever your Part B coverage is. And then anything that is outpatient and DME, walkers, wheelchairs, wound care supplies, etc., are covered under Part B. Part C, completely different. Part C is when you have your coverage of Part A and Part B managed by another company. The government's no longer managing it. The government is giving some money to the insurance company